Good morning. The chief host, the president of PSN, Mazi Sam Ohuabunwa, the chairman of NAIP, pharmacist IG Anoku, your excellencies, distinguished ladies and gentlemen, all protocols duly observed. My name is Dr. Anthony Ikeme. I'm the president of NAPPSA, Nigerian Association of Pharmacists and Pharmaceutical Scientists in the Americas. And it is my distinct pleasure and a personal privilege to humbly share my thoughts on advancing the industrial pharmacy sector in a volatile economy with such an august gathering like yourself. See, the topic for this keynote presentation cannot be more apt for the present moment in time. The global economy remains in a state of volatility almost a year since the first case of coronavirus was discovered in Wuhan, China, back in December 2019. Though the understanding of the management of the coronavirus disease has improved significantly, the second wave of the disease, which is anticipated to hit many northern economies in the winter months, leave the world still reeling in uncertainty. Like every disruptive event, the COVID-19 pandemic revealed the vulnerabilities and weaknesses in our system, and again reminded us of the huge opportunity for Nigeria to play actively in the global health and pharmaceutical enterprise. My role today is to make the case why we, as a nation, must seize this moment to turn a corner and finally make a bold effort to transform the Nigerian pharmaceutical sector. I'm incredibly proud to be making this case at a NAIP conference. NAIP is one organization in Nigeria that has demonstrated the boldness to not just dream about the future, but take action to realize that dream. I hope to convince everyone listening at this conference and everyone that gets to hear the playback of this speech in the future to support NAIP's vision for the Nigerian pharmaceutical sector with all their heart, with all their might, energy, and resources. But first, I will start with an overview of the agenda for my presentation. First, I have provided you the introduction to my presentation. Next, I will discuss the state of the Nigeria's pharmaceutical sector as a contextual backdrop as to why a disruptive change is desperately needed. Following that, I will discuss how the sector fared over the course of the pandemic and why we should focus on the lessons that can be learned from that experience. Now, I will then end with a discussion of how the Pharmaceutical Park proposed by NAIP could be a rallying point and a launch pad for that transformation we seek. So, I start by looking at the Nigerian pharmaceutical sector. The Nigerian pharmaceutical sector can be said to already be in a state of volatility before the pandemic threw the world into chaos. Access to healthcare and medicines remains a challenge to Nigerian citizens, and this is exacerbated by low life expectancy and poor economics. With the wide gaps in physical and regulatory infrastructure, the Nigerian capacity to develop the pharmaceutical sector is severely hampered. Nigeria is lacking in a state-of-the-art facilities that is necessary for building a solid pharmaceutical sector. They lack relevant, experienced personnel to drive the pharmaceutical sector agenda. You also have lack of local raw materials, underdeveloped petrochemical and primary API manufacturing capacity. There is low uptake of pharmaceutical technology. There's low research and development capacity. And that is made even worse by the currency volatility that affect the players in the Nigerian pharmaceutical sector. The regulatory guidelines are misaligned. Government policies are not tailored to drive the pharmaceutical sector agenda. The result of all of this is underdeveloped capabilities for research and development, for innovation, and for manufacturing. Perhaps our greatest failure is in the lack of an actively executed national strategy for Nigeria's pharmaceutical economic sector development. I believe in strategic planning, and when you fail to plan, you have planned to fail. Without an overarching strategy that informs us as to where to invest, what to prioritize, what metric to measure, and how to track progress, the chance for success is very low. So, when the underpinning pillars of the pharma sector success are weak, it is no surprise that our pharmaceutical sector performance is below par, with Nigeria being outpaced by her peers. Start with the pharmaceutical market. The Nigerian pharmaceutical market seems set for foreign products, with almost total dependence on imports from China and India. Approximately 70% of our pharmaceutical products are imported. Many estimate that a total of $600 million worth of medicaments are procured from India and China every year. Over 90% or maybe 100% of API and other pharmaceutical raw materials are also imported from India and China. The implication is that the resources that could have gone into investment to expand the local production capacity ends up as profit to foreign companies, weakening the chances of locally developing a full pharmaceutical value chain operations in Nigeria. So one can say that the vulnerabilities have always been there in Nigeria even before the COVID-19 pandemic came along. Now, COVID-19 only exacerbated the volatilities that we already know existed, and once again reminded us how vulnerable we are to the vagaries of other nations' decisions and how powerless we are to determine our own destiny. Two key points I want to highlight about the Nigerian pharmaceutical sector during the pandemic period. The first is the point about our powerlessness and vulnerability. It is fair to say that the Nigerian pharmaceutical sector was totally unprepared for the pandemic, and that if the virus had been as endemic in Nigeria as feared, the Nigerian pharmaceutical sector is not equipped or was not equipped to be a strong part of the solution. Recall how chaotic the pharmaceutical sector was at the height of the pandemic back in March and April. The moment China shut down because of the high incidence of coronavirus, and India announced that they will stop pharmaceutical export of some key pharmaceutical products, all hell was let loose. Many Nigerian pharmaceutical companies became paralyzed. Pharmaceutical distribution came to near standstill because consignments were taking longer to get to Nigeria. Manufacturing was limited only to stockpiles of pharmaceutical ingredients already in stock, as no new orders could come in. Our hospitals were more fearful of the virus than the patients. There were stories of hospital staff running away from patients as opposed to being a calming voice that educates and heals. With hospitals a no-go area, pharmaceutical detailing was greatly impaired. The question is, why was our response so weak? And the answer is known to everybody here, because we are weakened by our dependence on China. This slide shows how dominant China has been in global manufacturing in general, and pharmaceutical product manufacturing in particular. China's role as the de facto world's factory played a huge role in exacerbating the global COVID-19 response in general. With the shutdown of China, it was like the global manufacturing engine was switched off. China controls over 28% of all global manufacturing, has the largest share by any one country anywhere in the world. And when it comes to the pharmaceutical products relevant to pandemic, the percentages are even higher. In some cases, they are actually the sole source of the product that they manufacture. And this slide shows that that China controls about 50% of global medicine products and 40% of all APIs. They also account for 50% of the global face mask manufacturing, the largest share of all PPE manufacturing in the world. It was this scale of dominance that led to the emergence of the China Plus One business strategy, which essentially seeks to diversify away from China into other countries for reasons of cost, safety, and long-term stability. This was initially championed by US and Japan, but has since been embraced more widely across the globe. The disruption of the global supply chain arising from the COVID-19 pandemic has amplified that call. The last 2 months of 2020 saw a 17% decline in China exports due to COVID-19 shutdown. It is expected that more diversification away from China is going to occur in the coming years. The question then is, who is prepared to take advantage of this shift? That leads me to the second point I want to make about Nigeria's performance during the pandemic. It is the missed opportunity due to lack of preparedness. We regret that Nigeria counts among those that missed out completely on the opportunities presented by the truncation of the global medical and pharmaceutical supply chain due to the COVID-19 pandemic. At the peak of the COVID-19 pandemic, the world's supply chain faced a route to branch shutdown, unlike any seen in modern peacetime, as efforts to contain the coronavirus outbreak hit every part of the globe, of course, including China. Specifically, with the shutdown of China, many nations realized the risk in China's dominant role as the world's factory and the implication it portends for their local economy in particular and the global economy in general. As part of their de-risking strategy, many nations started seeking alternative sources for medical and pharmaceutical products, including but not limited, of course, to medicines, to PPE, medical consumables, medical equipment, and so on. The countries who were prepared beforehand are now benefiting from this shift in global supply chain dynamics. Nigeria, unfortunately, is not one of them. The slide on your screen shows some of those countries to whom many other countries are now turning to as alternatives to China. You will see Vietnam, Malaysia, Thailand, Philippines, and Indonesia. These are some of the key nations benefiting from the China Plus One phenomenon. Why is Nigeria not on that list? Nigeria has every reason to be on that list. Recall that Goldman Sachs Investment Bank identified Nigeria amongst the 11 nations they dubbed the next 11 group of countries. These are countries that were set to be one of the world's largest economies in the 21st century. Following their successful predictions with BRIC, they started looking at these countries as the next set of countries that will make it big in the global affairs. If you look at the slide on your screen, 3 of the nations currently in that group, alongside Nigeria, are among the current beneficiaries of the China Plus One tectonic shift. The question again is, where is Nigeria? Why is Nigeria not on that list? So, it is not like we've not had warnings. The world has a long history of disease outbreaks and pandemics, and Nigeria has been part of that experience. We had a close shave with Ebola in 2014. We are still dealing with Lassa fever, which has been on the increase every year since 2015. So as a nation, we have enough experience with disease outbreaks and near pandemics to have understood the importance of preparedness, the need to not only create robust protocols for the prevention and containment of pandemics, but to also retain the control for the production of the therapeutics necessary to cure the sick. It is in this context that we must heed the warning inherent in this quote that history repeats itself until we learn lessons that we need to change our path. Again, I repeat, history repeats itself until we learn lessons that we need to change our path. So, what lessons should we learn from the long history of volatility in the Nigerian pharmaceutical sector and the current volatility engendered by the COVID-19 experience? I will share 4 key lessons. So, first, key lesson number 1, we must recognize the security imperatives of reliance on other countries for the entire value chain of our pharmaceutical supplies. Specifically, our reliance on China and India is a huge security risk. In fact, it is dangerous. Just look at the data on this slide and judge for yourself how powerless Nigeria is relative to China and India. Let's focus on just API for a moment. China has the capacity to make all the APIs they need, so much so that they can supply 40% of API to the rest of the world. They also supply 70% of all India's API, which means that India can manufacture 30% of their own API needs. Nigeria, on the other hand, manufactures zero APIs. China has pretty much achieved self-sufficiency in API manufacturing. India already has the ability and just need to upscale capacity. But Nigeria is not on the map. Now, you can do the same analysis with the supply sources for Medicare, for medicine, for PPE, for medical consumables, and medical equipment. And you will get exact same result. We lack the ability to control our destiny. So ask yourself, who has the power? What risk do we run by depending on others rather than develop our own capacity? Andrew Badrock answered that question for us when he recognized that we need to look at medication on an equivalent level of strategic importance as weapons. I will easily add PPE, medical equipment such as respirators and other medical supplies on this list. When we don't recognize this implication, we are not paying attention to how strategically unsafe it is to depend on another country for everything that we need for our medical and pharmaceutical supplies. The evidence of this assertion played out vividly at the height of the pandemic. With the heightened tension between the USA and China, there was exchange of words between the two countries. And in retaliation for the trade disagreement between the two countries, China threatened to cut off drug exports to the US, with the knowledge that US depends on them for about 70% of their medications. This means that control of medications can actually be used as an instrument of war, and goes to prove that no country can achieve healthcare sufficiency without substantial control over their pharmaceutical manufacturing and supply chain. Key lesson number 2, the world is moving so fast that slow starters and non-starters will be left behind. At the PSN conference in Kaduna last November, I said that the time has come for Nigerian pharmaceutical stakeholders to stop whining and start strategizing. Every word of that assertion remains true today. We should look at what other countries have done to learn this lesson. And I have a couple examples for you. Long before this pandemic, many emerging economies started their journey to pharmaceutical sector transformation. Take Singapore. Singapore's development in the pharma sector started with the launch of the Biomedical Science Initiative in 2000. It created biomedical science clusters to take advantage of synergies. Companies in the clusters partnered with local academic and research institutions on pharmaceutical innovation. Today, Singapore is outperforming Nigeria in the area of innovation, R&D, and pharmaceutical production. South Korea is another example. Started to develop its pharma sector with the Biotechnology Development Plan in 1998. The industry revenue increased 14 times over a short period of 2001 to 2005 due to a strong state investment and scientific success of their researchers. Invention of 15 new molecules over the period put them at the seventh position in international patent competitiveness. It is the investments they made back in time that underpin the success they are having now. It is competitive in this world. No country is waiting for the next. Nations make strategic decisions and they execute to the best of their ability and achieve the result they deserve based on their effort. So, to be competitive going into the future, Nigeria must come up with a deliberate and actively executed national strategy for pharmaceutical economic sector development. Nothing less will do. It is the same mindset and thinking that has informed the national response to the pandemic. Those same countries that understood the need for deliberate planning are the ones that are proactively making assessments about the pharmaceutical landscape given the current events, and they are making new decisions about the future. I will again give example with India. They have specifically resolved to drastically reduce their dependence on China through a range of strategic policies. They have launched what they call their own version of the China Plus One policy. The plan includes identification and prioritization of the production of 53 raw materials and active pharmaceutical ingredients needed to fill in the supply gaps of affordable medicines. They are investing $1.3 billion in domestic pharmaceutical producers. They are reviving state-run companies to ramp up cheap generic production. They also launched a $140 million initiative to build 3 bulk drug parks. And in a move to make it easier for investors to identify sites for setting up their manufacturing units, they launched a one-stop repository of a national GIS-enabled land bank. All of these are geared towards making sure that they are the masters of their destiny, that they control their circumstance, and they don't leave it to other countries to dictate their fate. Nigeria must learn that lesson. Globalization means that the world is your marketplace. Nations are focused on outthinking and out strategizing each other in this scramble for global market. So, what is Nigeria doing to compete? That's a question we have to ask ourselves and should keep asking ourselves as we reflect through the course of this conference and as we reflect on the opportunity the NAIP project presents to us as a country. Key lesson number 3. The engagement of the Nigerian diaspora is critical to the success of any pharmaceutical sector strategy we formulate as a nation. Because any pharmaceutical sector strategy that does not include the diaspora is a non-starter. Diaspora contribution to the economy is already well established, and they come in multiple ways. We already know about the remittances. Nigeria actually tops the 5 highest receivers of diaspora remittance in the world. It grew from $2.3 billion in 2004 to about $35 billion in 2016. And I believe it's much higher in 2020, despite the downturn in the economy due to the pandemic. Also, they contribute through trade. They create connections between producers and consumers in countries in Nigeria and their country of destination where they live. They also introduce products from the origin, from home, Nigeria, to the country where they live. In our case, it will be the US. So that way, they contribute to the economy of back home. They also contribute via investment. Diasporans can invest directly in the country of origin through stocks, diaspora bond, or other special mechanism that a smart nation can put together to help draw them in and make them participants in the economy. They can also encourage others in their host country to do the same. Finally, they also contribute through skills and knowledge transfer. They gain valuable skills, experience, and knowledge, which is then transferred back through mentorship, training, volunteering, or just working side by side with their colleagues back home. Bottom line, the diaspora is essential. The steep climb we need to make to global relevance in the global pharmaceutical enterprise requires that we shoot from all cylinders. We must robustly and efficiently engage all facets of our national human resource asset and machinery towards achieving our national pharmaceutical sector strategy. No one goes to war with one hand tied behind their back. Besides, history tells us that this is the right thing to do. Right? Think about the Indian example. It was the collaboration between the Indian diaspora and the Indians in the nation's IT sector that led to the replication of the American Silicon Valley in India, in what is called Bangalore. The Chinese also offers us another example. Historical data show that the diaspora Chinese provided the lion's share of inward foreign direct investment that fueled the growth of China into a manufacturing powerhouse it is today. And they work collaboratively with their partners at home to deploy this investment via business partnerships. Finally, I will illustrate with the Jewish example, which mostly it may be the most cited example of the collaborative success of diaspora and homeland. The Jewish diaspora has provided political support. They have volunteered. They serve as advisors. They invest. They provide loans, donations, technology, and business contacts, and work collaboratively with their counterparts in the homeland to channel these things where they are needed for maximum impact. They also deploy their political assets in their country of origin to make sure that global decisions are made in a way that is favorable to their homeland. The above examples show how partnering with the citizens in diaspora can help to fuel growth back home. And mostly, these examples were achieved with the citizens and professionals working together before the government came behind. So, the private sector leading and the public sector coming after the fact. Given how much grounds we need to cover in the global scramble for relevance, especially in the pharmaceutical sector, any failure to fully engage the diaspora in the strategic development of Nigerian pharmaceutical sector should be considered developmental malpractice. I mean, fully engaged in all caps. they should be courted, engaged, consulted, harnessed for national development. That is the only way we can ensure that we are not missing out on any opportunity for our transformation. Final lesson I have, key lesson number 4, is that we still have the opportunity to be a big player in the global pharmaceutical enterprise. But it requires that we start now. Global pharmaceutical will continue to grow. Globalization remains the reality of our life. This means that the need for medicines will never stop. Outsourcing opportunities in manufacturing and clinical trials will continue to grow. And opportunities will always exist in the abundance of medicines facing patent expiration, which translates to opportunity for generic manufacturing. Nigeria also has inherent strengths in her vast human, natural, and economic resources and can benefit from the strong economic buying power of her large population. But it doesn't mean we should delay. A Nigerian proverb says that when you wake up is your morning. So I want to make an update to that proverb, and it's to remind us that it will not serve us well to wake up at night. We must wake up now and start running and never look back. That brings us to the Pharmaceutical Park project, an opportunity which I'm very excited about. I believe, and strongly too, that the Pharmaceutical Park project is a rallying point for the renaissance of the Nigerian pharmaceutical sector. But let's be clear, the Pharmaceutical Park are not the only solution Nigeria needs, but it is a critical opportunity that we must all embrace as a rallying point for building into the future. Because a pharmaceutical hub like Pharmacity creates an opportunity for us to turn a new page in the Nigerian pharmaceutical sector development. It means that we are not waiting around, waiting for a miracle, but that we have a targeted, focused plan to follow. It creates an ecosystem for strong Nigerian pharmaceutical sector growth because it takes advantage of the synergies and value chain synchronization between the related industries that will inhabit the park. It will help to build a self-reliant supply chain security. It will more readily attract foreign direct investment, and we aid the overall development of the Nigerian pharmaceutical industry. Call me biased, but I have a special fondness for the diasporan angle to this opportunity. As the president of an organization peopled by proud Nigerians who are invested in elevating the image of Nigeria abroad and to tell the true story about the indomitable spirit, creativity, and innovativeness of Nigerians, home and abroad, nothing will make us more proud than to see Nigerian pharmaceutical products become a routine part of the US pharmaceutical market and other markets around the world. Our large community of independent pharmacists in the USA are looking forward to the day they will stock up their pharmacy stores with Nigerian-made medications and PPE. Pharmacity provides the diasporan community such a great chance. It also provides a landing point for the engagement of the diasporans in the pharmaceutical market. They can focus their investments on industries of their interest. They can bring their expertise. They can help facilitate institutional and organizational relationships between the companies in Nigeria and their institutions in diaspora where they work. Pharmacists in NAPPSA with their own pharmacies can be the main conduit for bringing products manufactured in the Pharmaceutical Park into the United States of America. As I said, this has been the dream of all of these pharmacy owners, to be able to stock products in their store that says that magic phrase, made in Nigeria. But as I said earlier, pharmaceutical park will not solve all the problems. We need an even more ambitious, overarching strategy to make the pharmaceutical parks successful and sustainable. We need government strategic commitment to the entire spectrum of the scientific knowledge base. We need the government to set up a national system of innovation that enables policymakers adopt a more systemic approach for enhancing innovative performance through joint industry research, public-private sector initiatives and partnerships, technology diffusion, and movement of personnel. We need the commitment of government, period. Because the private sector, though can go so far, can only go so far. In closing, let me call all stakeholders to rally behind the Pharmacity project. As I like to say, we should not let this pandemic go to waste, but rather, the lessons from it should inform our decisions going into the future. Life has given us a lemon. Let's make a lemonade. There is no better time than now to seize the opportunity thrown up by the volatility in the global pharmaceutical economy. We are lucky to have NAIP, who has painstakingly created a stepping stone for engaging the global pharmaceutical economy. The question to all of us who are stakeholders is not how will they do it, but rather, what will I do to make this thing happen? What will we contribute to make this a reality? I urge the Nigerian government, all state and local governments in Nigeria, all pharmaceutical and medical professional organizations in Nigeria and in diaspora, banks, local and foreign investors, global, regional, and multilateral institutions, and all Nigerians at home and abroad to rally round behind NAIP as they lead the Nigerian nation on this journey towards the transformation of the Nigerian pharmaceutical sector through the Pharmacity project. Thank you for listening.